I see a pretty broad spectrum of patients from more severe problems like intracranial hemorrhages or ischemic strokes to brain tumors. Sometimes it's more simple things like confusion or headaches, but it's pretty broad. My favorite part of my job is stroke codes, which is what I do usually in the emergency room and sometimes inside the hospital. And that's for people who have acute strokes and they first hit the door and their symptoms have usually been going on for a very brief amount of time. There's a few things we can do for people early on in stroke that we can't later. Things like clot busters or surgery to remove large clots in the brain. And that's the area of my field where I feel I can make the biggest difference very quickly. And these are the patients who come in who can't move one side of the body, and after an intervention, they could potentially be back to normal within an hour or two. I feel like every patient is sort of a story, and when they come in is the start of their story, when they come into the hospital, and then every step along the way is kind of us figuring out what's going on with them and how to get them better. I want the best care for my patients, and then I do everything I can to implement that.